I'm Dan Nigrin. I'm the Chief Information Officer at MaineHealth. Prior to MaineHealth, I worked at Boston Children's Hospital. My background is as a pediatric endocrinologist who somehow got interested in technology along the way. A fantastic panel, first of all. What I loved about it was the diversity of who we had on the panel, obviously all related in some way to healthcare, but covering all parts of it, from the patient care point of view, all the way to research labs at the JACs that you mentioned, to startups, healthcare startups, and to the RU here and thinking about education of our future leaders in this space. So that diversity of perspectives on how AI and healthcare are intersecting and how it's developing was what I sort of loved the most about the panel and hearing everyone's perspective. So I thought it was fantastic. We need to think about AI responsibly. Because trust me, things can go afoul very quickly if we're not paying attention. So whether that's how algorithms behind the artificial intelligence are trained, the data sets that they're being trained on, thinking about how we're educating our future leaders and making sure that that's done, excuse me, in an equitable way. All of these things are important for us to talk about now and essentially go in with eyes open. There's an initiative underway which uses NLP, or natural language processing, coupled together with artificial intelligence to essentially listen in on a conversation between a patient and a doctor and to generate the documentation of that encounter, what I like to say automagically. And this is a huge burden off of the clinician's shoulders that they currently have, and essentially allows them to focus their attention on the patient, to listen to the patient, not be distracted by a computer or technology, and to have the bulk of the documentation challenge taken away from them. So an incredible use of this new technology. There's a number actually that we haven't even talked too much about it around imaging and the use of artificial intelligence to unburden the imaging interpreters, the radiologists, not to take their roles away, we still need them, but to help, for example, triage how studies are interpreted by them, flagging the ones where there seems to be the highest risk of an abnormality being present, floating those to the top of the radiologist queue to say, hey, pay attention to this one because there's something amiss here. So just very practical applications of the technology that are ultimately going to help patients.